It is completely normal to wonder what your body might feel like after a medical procedure. You may feel a little curious about what to expect, especially when a procedure involves a delicate organ like your kidneys. After a kidney biopsy, it is very common to experience some mild pain or discomfort at the biopsy site, often described as soreness or tenderness. You might also notice a small amount of blood in your urine, which is usually temporary. Fatigue and bruising around the biopsy area are also expected. These side effects occur primarily because a kidney biopsy involves carefully inserting a thin needle to take a small tissue sample from your kidney. This creates a tiny wound, and your body naturally responds with inflammation and healing. The soreness is due to the needle passing through skin and muscle tissue, and the kidney itself. The temporary blood in your urine, medically known as hematuria, happens when the biopsy needle passes through the kidney, which is rich in blood vessels. As the tiny blood vessels heal, this bleeding usually subsides quickly. Bruising on your skin is also a normal response, as some small blood vessels near the surface might be affected by the needle. Factors like the type of biopsy performed, such as a percutaneous biopsy through the skin or a laparoscopic biopsy through a small incision, can influence the extent of these effects. Your individual pain tolerance and how quickly your body heals also play a role in how pronounced these sensations might be. To manage these common side effects, rest is truly your best friend. Your doctor will likely advise you to avoid strenuous activities and heavy lifting for at least 24 to 48 hours. Applying a cold pack to the biopsy site can help reduce swelling and discomfort. Staying well hydrated by drinking plenty of fluids can also help flush your system and aid in recovery, especially if you experience mild hematuria. For pain, over-the-counter pain relievers, as recommended by your doctor, can be very effective. It is always important to follow your doctor's specific post-biopsy instructions, as they are tailored to your individual situation. However, do contact your doctor right away if you experience severe pain, fever, significant or persistent bleeding in your urine, difficulty urinating, or any signs of infection such as redness, warmth, or pus at the biopsy site. These could indicate a more serious, though rare, complication. Understanding these typical responses helps you distinguish between normal healing and something that needs medical attention. A key insight is that while minor discomforts are common, serious complications like significant bleeding or infection are actually quite rare. Medical professionals, often a nephrologist or kidney specialist, and a radiologist, work together to ensure the procedure is as safe as possible. They use advanced imaging guidance, such as ultrasound, to precisely target the biopsy, minimizing risks. Knowing this can greatly reduce any post-procedure anxiety, allowing you to focus on your recovery. Remember, your medical team is there to support you through every step of this process. By being prepared for these common post-biopsy sensations and knowing how to manage them, you empower yourself to navigate your recovery smoothly. This knowledge allows you to rest comfortably, monitor your body effectively, and feel confident in seeking care if unexpected symptoms arise. A well-informed patient is better equipped to partner with their healthcare team for the best possible outcome, making your healing journey less stressful and more predictable.